Good evening, everyone. Please welcome our hosts this evening for the induction ceremony, Academy President Linda Scott and President-elect Deborah Barksdale.
Good evening, and thank you. Oh, we've learned today, haven't we? But we're going to do that one more time. Good evening. Thank you, and welcome to the American Academy of Nursing's 2024 induction ceremony. I am Dr. Linda Scott, and it is my honor to serve as your Academy President. Thank you for that, too. And I am joined by Dr. Deborah Barksdale, the Academy's President-elect. Deborah and I have the true honor of presiding over this wonderful celebration to recognize the contributions of some of the most accomplished nurse leaders around the globe. As the president of the Academy, I often reflect on the magnitude of this organization and the significance associated with being selected for induction. I am sure that we all can remember the day we received notification to become a fellow, and even more so, our own induction ceremonies. I can still remember when I told my family I was going to become an Academy Fellow, how excited and proud they were with this honor. I am sure that the families and friends of our new fellows feel that same sense of pride and excitement. The Academy inducts fellows from any practice area, leadership background, population served, and community reach. This is one of the things that makes us unique. And given the vast and varied expertise of our collective brain trust, the Academy's focal aim to shape health policy and ensure our vision of healthy lives for all people is not only aspirational, but attainable. To do that, our fellowship, consisting of over 3,000 nurse leaders, comes together to propose the most novel, effective, efficient, and equity-centered policy solutions. As nurses, we have a social contract with the public to provide high-quality, compassionate care. As an academy, we have a social contract with the public to change policies that impede health and well-being. By inducting this new class of fellows, our ability to enact change is only further amplified. Deborah and I are thrilled to co-host this truly inspiring evening. While we are celebrating the 2024 class of fellows, we are also excited to be growing our family of change agents and trailblazers. Together, the Academy Fellowship will create the policy solutions that matter, inspire change that propels transformation, and envision a healthier future. As we begin, let us thank our generous sponsor for this evening's event. For over a decade, United Health Group has supported the Academy's induction ceremony. We are deeply grateful for their continued commitment to honoring the accomplishments of nurse leaders who are revolutionizing care through their research, practice, and innovations. By sponsoring this event, United Health Group's Center for Clinician Advancement is also supporting the patients we serve and progress towards their individual health journey. I also want to sincerely thank everyone in the audience for joining us in supporting the success of our new fellows. In this room are spouses, partners, children, family members, friends, colleagues, and mentors. And in fact, we have more attendees at this induction ceremony than we have had in our 50-year history. We have to say, this is certainly an incredible fan club. But truly, when we celebrate each of these new fellows, we are celebrating you. Without your support, they could not have achieved the change that they are being inducted for. We are grateful to have you here with us and as a part of the Academy's rich tradition of recognizing and celebrating nurse champions of change. To each of our new fellows, congratulations on your induction this evening. Each of you are extremely deserving of this honor, and while I hope the excitement of this event creates a powerful memory for you to hold for a lifetime, I also hope that this excitement transcends into your engagement into our prestigious organization. The fan credential is an individual honor, but the fellowship is a collective body of leaders committed to our social contract with the public, policy change.
Tonight, we commemorate the achievements of 229 accomplished nurses who will be joining the Academy as fellows. These nurses represent 37 states, the District of Columbia, Guam, and 14 countries. You will hear from our inductees in their own words how they have made a profound impact on the care provided to patients, the profession's influence on health systems, policies to improve health equity and quality of care, and educators who are making strides to prepare the next generation of nurses to lead the profession. We also pay tribute to the visionary leaders who will become honorary fellows of our organization tonight. Like Linda, I offer my deep congratulations to each of you. Yesterday, we had the opportunity to recognize the 2024 Living Legends. We celebrated their remarkable contributions to health and healthcare and their ability to significantly amplify the voice of the profession. Dr. Suzanne Bakken, Dr. Rita Chow, Dr. Julie Fairman, Dr. Faye Gary, and Dr. Matthew Measy. To all of our living legends, those who are in the room today, and those we recognized last night, and those who have passed away, thank you for your inspirational stewardship of the profession and helping to leave a lasting legacy.
Before we begin, I'd like to personally thank the courageous leaders whose vision and dedication helped to build the American Academy of Nursing. The Academy was founded in 1973 to advance new concepts in nursing and health. For more than 50 years, with our fellows and partners, the organization has advocated boldly to address the most pressing policy issues in healthcare.
With leadership, innovation, and science as our pillars, the Academy is recognized within the nursing profession, among healthcare colleagues, and around the globe as a source for evidence-informed policy solutions. Our many thanks to the 36 charter members of our organization who launched this incredible organization. We celebrate their legacy tonight during our induction.
It is also my privilege to recognize the past presidents of the Academy. Over the course of the Academy's 5 decades, the vision, determination, and courageous leadership of our past presidents has transformed nursing and how we engage in policy. By developing structures, governance, and expert bodies, the Academy has grown stronger because of their vision. Each president has embraced the Academy's central direction of serving the public by advancing the generation, synthesis, and dissemination of nursing knowledge. I am proud to now be a part of this legacy for the Academy.
Finally, Linda and I would like to personally honor our uniformed services personnel and veterans in the audience this evening. If you could please stand to be recognized. We are grateful for your service, leadership, and the sacrifices you and your families have made. The effort of our service members are not only needed in times of war and emergencies, but critically important to health during humanitarian and natural disaster relief. And for that, we thank you.
Before we launch into the festivities, we have 2 very special awards to bestow this evening. Introduced during our 50th anniversary, it is my privilege to honor this year's recipient of the Academy's Mary Elizabeth Carnegie Leadership Award in Equity, Diversity, and Inclusivity. Created in the memory of Dr. Carnegie, the 6th president of the Academy from 1978 to 1979, and as an inaugural living legend in 1994, she was instrumental in breaking down racial barriers. This year's recipient is Dr. Beverly Malone. Dr. Malone is the President and Chief Executive Officer of the National League for Nursing, which represents nearly 45,000 individual members and over 1,000 institutional members. Under Dr. Malone's leadership, NLN has advanced the science of nursing education by promoting greater collaboration among stakeholders, increasing diversity in nursing and nursing education, and advancing excellence in care for patients. Dr. Malone's distinguished career has blended policy, education, administration, and practice. From the United States to the United Kingdom, Dr. Malone's contributions have been nothing short of remarkable. She held the position of Federal Deputy Assistant Secretary for Health under President Bill Clinton, and was also a member of the Advisory Commission on Consumer Protection and Quality in the Healthcare Industry. Additionally, Dr. Malone served on the U.S. Department of Health and Human Services Minority Health Federal Advisory Committee. Dr. Malone was the first African-American General Secretary of the United Kingdom Royal College of Nursing, representing 400,000 nurses, and served as a member of the UK delegation to the World Health Assembly. Dr. Malone has been a consistent and tireless advocate for increasing diversity, equity, inclusion, justice, accessibility, and belonging within the profession. Through her own personal experiences and determination to ensure others were provided educational and mentoring opportunities, Dr. Malone carries a legacy that spans decades and is demonstrated by the accomplishments of the nurses who were supported by her leadership. serving as Dean of Nursing at North Carolina you know that A&T. That, a historically black university, and as a former president of the American Nurses Association, Dr. Malone touched the lives of many. She understands that humans need humanity, and we must create pathways for dignity and continual learning. In a recent article in which Dr. Malone was interviewed for The Lancet, she was quoted as saying, "There is a difference in how people are treated and the care they're given. And for a lot of people, it is unconscious bias. It is the stereotypes that are built into your system, and your innate values show up in the care that you're delivering. The question for providers is, how much self-reflection have you done lately? How much are you looking at who you are and how you got to be who you are, and how that affects the care you provide?" What powerful words. The Academy is honored to bestow the Mary Elizabeth Carnegie Leadership Award in Equity, Diversity, and Inclusivity to Dr. Beverly Malone, a leader and a living legend who inspires us all to reflect and strive to constantly do better.
Colleagues, I am delighted and honored to be here and to receive this award, especially in the name of Dr. Mary Elizabeth Carnegie. She was one of my mentors extraordinaire. And I want to thank the Academy. I want to thank President Scott. I want to thank our President-elect. And I am delighted to also acknowledge some of my colleagues in the audience and one of my children. I'd like to thank Dr. Patricia Sharpneck. Would you please stand to be acknowledged? She's the chair of the NLN Board of Governors. I'd like to thank Dr. Janice Brewington, and I have no idea if she's here or not, but thank her. It will get to her eventually. I would like to thank my daughter, Dr. Tosha Winger, if she would stand and be acknowledged. Yeah, thank you. She's my oldest. I have the opportunity to speak with you about why diversity means something to me and what this award means to me. And it starts with an understanding that things are not done by accident, but by design. And that diversity to me has so much to do with not just differences, it has to do with values. It has to do with who you are and what you are about, and it has to do with me being a nurse. My colleagues talked about a social contract. It's just part of what we do. It's our job to understand diversity. So I am so committed to the values of caring. If you're a nurse, come on, you should care. Caring is promoting health, healing, and hope in response to the human condition. If you are a nurse, you should have some integrity. I know we're in DC, but you should have a little bit of it. And integrity is respecting the dignity and moral wholeness of every person without condition or limitation. That means if I like you, I'll take care of you, and if I don't like you, I will still take care of you. I'm a nurse. And then there's excellence. This is about nursing. There's excellence, co-creating and implementing transformative strategies with daring ingenuity. That's who we are. We are bold, we are bright. That's what the Academy is about. So it's these values that make us a nurse. And I came to the idea that it's E pluribus unum, out of many one. We're all different. Nurses are like bouquets of flowers. Even our colleagues who are brothers, we are just fantastic. But we are still one. We are different, but we come together as one. So we're one and we are many. We are one and we are many. Do you see the modulation? Do you see the rhythm? Many, one, out of many, one. It's all right for me if you say a nurse is a nurse is a nurse, because I am a nurse, and I am joyful about that. I am diverse. I'm a black woman. I'm a psychiatric mental health nurse extraordinaire. So, yeah. But I'm a nurse. And so those are the differences. That's the diversity. But out of that comes one. I'm a nurse. So I have a model that I use in my head, and I heard it somewhere else. I wish it was mine, but I want to share it with you. And it goes like this. I'm walking in authority, living life without apology. It's not wrong, dear. I belong here. So you might as well get used to me. Now I'm going to repeat that because I want to make sure you get it. I'm walking in my authority, living life without apology. It's not wrong, dear. I belong here. So you might as well get used to me. The only other comment I have is God has been very kind to me. Thank you so much.
Now, it is my honor to present the 2024 President's Award. The Academy's President's Award recognizes an individual who has made extraordinary, lifelong contributions to improving the health of individuals, families, and communities. This is the highest individual achievement award given by the Academy, and it is given at the discretion of the President to be awarded when someone has been identified as truly fitting of the honor. It is my privilege to recognize an individual whose name is synonymous with wellness and well-being, Dr. Bernadette Milnick. She is Vice President for Health Promotion and Chief Wellness Officer at The Ohio State University, the first to hold this type of position at an institution of higher learning in the nation. Dr. Milnick is also the Helene Fold Health Trust Professor of Evidence-Based Practice in the College of Nursing and Professor of Pediatrics and Psychiatry in the College of Medicine. She is also the founder of the Helene Fold Health Trust National Institute for Evidence-Based Practice in Nursing and Healthcare. A global leader for the profession, Dr. Milnick has shaped the fields of evidence-based practice for child and adolescent mental health, clinician well-being, as well as population health and well-being. Her passion for treating the whole person, body and mind, has changed policy and practice over the course of her career. As the principal investigator of over $36 million in funding from the National Institute of Health, Agency for Healthcare Research and Quality, and private foundations, Dr. Milnick has demonstrated the impact of her work by editing 7 books, publishing nearly 600 publications, and speaking around the world. In a recent PBS interview on what makes nurses vulnerable to burnout and how it impacts the care they provide, Dr. Milnick so aptly stated, "I have the philosophy, in God we trust, but everyone else better bring data to the table." Clearly, her mountains of research pay tribute to her own philosophy. Her perspective and insights on well-being are sought after by healthcare professionals across all disciplines. One of her most notable works is the Creating Opportunities for Personal Empowerment, or COPE, Cognitive Behavioral Skills, Building Program for Depression and Anxiety. The COPE programs are being used in primary care practices in all 50 states with reimbursement. Yes, I think that should be noted. K-12 schools and universities across the country, as well as in 5 other countries. Dr. Melnick's public service extends broadly. Currently, she serves as an elected board member and vice chair of the National Forum for Heart Disease and Stroke Prevention. She also serves on the National Academy of Medicine's Action Collaborative on Clinician Well-Being and Resilience. Dr. Melnick previously served on the United States Preventive Services Task Force, the National Institute of Nursing Research National Advisory Council, and the Behavioral Health Standing Committee of the National Quality Forum. Dr. Melnick is also the founder and immediate past president of the National Consortium for Building Healthy Academic Communities, a collaborative organization to improve population health in the nation's institutions of higher learning. When a leader of this caliber has accomplished so much to champion the health and wellness of communities around the globe, I could not be more honored than to bestow to her the Academy's President's Award. Dr. Melnick, you are truly an inspiration.
I am so humbled and grateful to be recognized in this way. I want to give the biggest dose of vitamin G for gratitude to our fabulous president, Dr. Linda Scott, our vice president, and the Academy. If we give and take a dose of vitamin G every day, our mood will improve and our people will be happier. I also want to give a dose of vitamin G to my wonderful husband, John, who has moved cross country for me twice, so I could pursue my dreams. My fantastic friends, Holly Brown, who came here specially to be with me today, but all my fabulous colleagues and friends who have supported a person who dreams so big, asks for forgiveness instead of permission, because I run fast. I really do. And in today's world, we don't have time. We don't have time for it to take 15 years to translate evidence into practice to improve care. If I, as a gal growing up in my little rural, poor coal mining town in southwestern Pennsylvania, could do what I've been blessed to do throughout my life, any of you can do whatever you dream of doing. The secret sauce of my success, 3 Ds, the ability to dream big. Helen Keller once was told it must be pathetic not to have eyesight. She said, no more pathetic to have eyesight but no vision. A lot of people think dreaming big is warm and fuzzy. But if you can't dream big, you're not going to accomplish big. You've got to dream big and bold. The second D, you've got to discover that's all about risk-taking and innovating. And lastly, you got to persist through what I call the character builders, because there's going to be many to accomplish your dreams. So I'm going to close by asking each and every one of you, please do not leave here tonight until you answer and write down the answer to this question. What are you gonna do in the next 5-7 years if you cannot fail? COVID took a lot of dreams away. There's inertia, there's burnout that is persistent throughout this country. We've got to support each other to dream big, to discover, and to deliver. I'm so excited for what we can do together to create a healthier healthcare system and a brighter future, a healthier future for the people throughout the United States and globe. I believe in you, and I believe in us as a team. Thank you.
Now, a wonderful celebration of our award recipients, and it is also time to begin our other celebration. Deborah and I are thrilled to welcome the 2024 class of new fellows into the American Academy of Nursing. Their diverse portfolios demonstrate impact that is far-reaching and human-centric. This night would not have been possible without the time, energy, and passion of our Academy's Fellow Selection Committee. This year, the committee was led by Chair Dr. Marla DeJean and Co-Chair Dr. Garrett Chan. We also welcome the addition of the International Subcommittee chaired by Dr. Pam Cipriano. As a former member of the Fellow Selection Committee, I know the difficult task to select fellows among the outstanding candidates whose work is reviewed. This year, the committee reviewed 409 applications, which is truly remarkable and is one of the highest number of applications for the Academy. Tonight, as Deborah mentioned, we will recognize 229 nurse leaders. The American Academy of Nursing's Board of Directors We're proud to accept the names of these exceptional leaders recommended by the Fellow Selection Committee for induction, who serve the public through policy, research, administration, practice, and academia.
In welcoming these fellows to the Academy, our numbers will grow to over 3,400 accomplished leaders who will aim to improve health and health equity. When these individuals choose to apply for the Academy's fellowship, they had to consider who would sponsor their work. All candidates must be supported by 2 fellows of the Academy who could speak to their impact and character as leaders. This is a critical role for the organization and one of the key ways fellows can give back to their organization. So on behalf of Linda and myself, I offer a deep appreciation and gratitude to all of the new fellows sponsors who chose to support and amplify our collective impact. Sponsors of the 2024 fellows, will you please stand to be recognized? Thank you.
As Deborah mentioned, we will hear from the fellows themselves. To learn more about the new fellows, their amazing accomplishments are captured in depth on the conference website for you to review after or during tonight's event. I encourage you to see these impressive bios online.
These recordings have been created by the new fellow inductees, and their content was determined solely by each fellow and do not necessarily reflect the views of the American Academy of Nursing.
So with that, and without further ado, let us begin tonight's celebration by recognizing nursing excellence. From the state of Alabama, Christy Acker.
On palliative care leadership and policy advocacy to achieve health equity, especially in rural and low-income populations. It is both compassion and passion that drive my efforts. I am honored to advocate for palliative care awareness and competency in clinical settings, in the classroom, and in the boardroom.
Wesley Davis.
With over 25 years of experience in emergency care, my contributions have shaped nursing practice, education, and leadership on a global scale. By leading teams through challenging issues, innovating educational models for nurse practitioners, and standardizing emergency NP education, I've influenced healthcare policy and advanced the quality of patient care worldwide.
Amy Lee.
I've integrated practice and education to make a lasting impact. My experience with vulnerable women has led me to a passion of improving their lives through my work. I have sought to advance intimate partner violence screening and response, prevent surgical site infection, decrease unintended pregnancies, and prepare students to ensure a lasting impact for the future.
Cordelia Nadeau.
Increasing diversity to the nursing workforce through recruitment and retention of minorities in baccalaureate nursing program is my main achievement. As a researcher, establishing the Tuskegee University Maternal, Child and Family Health Research Center with emphasis on improving health outcomes for women living in rural Alabama.
Courtney Sullivan.
I have led multi-country initiatives in quality improvement, education, and in setting childhood cancer control priorities. My program of research aims to close the childhood cancer survival gap between limited and well-resourced countries by targeting nursing's unique contribution.
From the state of Arkansas, Thomas Kippenbrock.
My contributions have advanced the nursing profession through my leadership and scholarship aimed at dismantling inequity and increasing diversity. I am one of the early academic nurse leaders to uncover gender and race disparities in nursing education, practice, and research.
Jamie Wiggins.
The most significant contribution to health that I have made has been through executive practice, workforce development advocacy, and regulatory policy. I transform organizational cultures that empower nurses, build strong teams, and improve patient outcomes. Through innovative academic practice partnerships, I have expanded pediatric healthcare capacity and nursing workforce diversity.
From the country of Australia, Kate Curtis.
My research collaborations have directly resulted in improved trauma care and funding for all major trauma hospitals in Australia, the third largest ambulance service in the world, changing their airway equipment, and emergency nurses having a validated, evidence-based framework to improve their clinical assessment and care of any patient presentation, type or age, called PI-RATE.
Jane Phillips.
My most significant contribution to healthcare has been advancing the field of palliative care nursing, leading to more compassionate, effective and patient-centred care practices.
From the state of California, Angela Banks.
My significant contribution to health has been through nursing education and workforce diversity. I have secured over $5.6 million in state and federal funding, supporting over 400 underrepresented undergraduate nursing students, thereby increasing racial and ethnic diversity of the nursing workforce.
Thomas Barkley Jr.
My greatest contribution to health is the creation of innovative educational tools and models for nurse practitioner students and faculty. Through my work, I have created psychometrically sound programs and diagnostic tests to gauge student competencies and improve academic outcomes.
Marianne Biogany.
My career has been committed to strengthening the diversity of the nursing workforce with a focus on faculty and the environments in which students learn, emphasizing the development of policies that promote student success.
Leslie Dubbin.
My primary contributions to nursing are through my research and scholarship that advance understandings of the ways in which structural inequalities influence the health and social well-being of marginalized communities. My research explores the intersections of race, housing, health systems, and communities, endeavoring to untangle the myriad ways in which structural inequalities are created, maintained, and reproduced.
Leslie Evertson.
My career is focused on transforming care delivery for people living with dementia. I developed the role of the dementia care specialist and have trained hundreds of advanced practice providers. This comprehensive dementia care model has been implemented in 26 healthcare systems and serves as the primary influence for CMS's GUIDE model, a national alternative payment model for dementia care.
Vicki Good.
My professional career focuses on developing, leading, and sustaining healthcare environments to ensure patient safety, optimal staffing, and nurses who thrive. I've done this as a health system executive and as president and now chief clinical officer of the world's largest specialty nursing organization.
Sharon Hampton.
My nursing career is dedicated to advancing education, practice, and policy to mitigate implicit bias and systemic racism. My integrated curriculum utilizing Watson-Caron science and inclusive leadership principles to transform nursing practice has profoundly impacted care equity and patient outcomes.
Lori Kennedy.
By pioneering the role of the acute care nurse practitioner in my own organization, I've improved patient outcomes. By leading impactful research, I have driven significant practice change. My work has led to better policies, more effective treatments, and enhanced collaboration. I am humbled that my dedication elevates neuroscience nursing and improves care globally.
Tracy Kirkland.
My most significant contribution to health has been the ability to create sustained windows of opportunity in training the next generation of nurse practitioners to mitigate health disparities and to improve health outcomes in medically underserved communities.
Annette Nassar.
As a nurse scientist, transformational leader, and past president of the Western Institute of Nursing, I have built strategic alliances that have led to productive collaborations with nurse scientists locally and nationally. My program of research is focused on pediatric liver transplantation and the impact it has on families.
Michelle Pelter.
The overarching goals of my program of research focuses on enhancing the diagnostic and prognostic capabilities of in-hospital electrocardiographic monitoring. My most recent work has concentrated on understanding false alarms associated with alarm fatigue in nurses and designing patient-centered solutions to improve patient outcomes.
Elizabeth Scruth.
Through implementation of a predictive analytics model in 21 hospitals in Northern California, it gives a lead time of up to 12 hours prior to a patient deteriorating, I've impacted the health of the communities I live and serve.
Stephanie Vaughn.
I led the development of the competency model for professional rehabilitation nursing that provides a framework for the specialty practice internationally. Recognized by the World Health Organization, I also served on the Rehabilitation 2030 Call to Action work group to develop a global competency framework that provides knowledge and skills for an international workforce.
From the country of Canada, Denise Bryant Lacouchus.
Through research, education, mentorship, and knowledge translation, I have impacted on health by improving policies and practices that have strengthened the health system's integration of specialized and advanced practice nurses and improved patient access to care in Canada and internationally.
Kristen Cleverly.
Advancing research, practice, and policy related to student and youth mental health care is my primary contribution. I aim to transform mental health care for youth through the design, implementation, and evaluation of services to improve access to and transitions between healthcare services.
Samantha Mayo.
With the goal of optimizing the long-term health and quality of life of people affected by blood cancers, my contributions have advanced research and practice in the field. As a main area of focus, I generate new knowledge about the impact and predictors of cancer-related cognitive impairment, test new interventions for symptom management, and generate evidence-based resources to support clinical management at the point of care.
Cheryl Reamer Kirkham.
I am honored to contribute to health globally as I lead an international network on mothering, albinism, and human rights. Drawing on critical perspectives, I spearhead research, education, and policy on spiritual caregiving, and have recently developed a future-facing, accessible PhD nursing program with curriculum on the full role of the nursing professoriate.
From the country of China, Changyi Chen.
My main contributions are as follows. As Dean, lead my school to a new height in research and academic excellence. As professor, opened multiple courses, monitored bachelor, master, and PhD students. As a research, lead many research projects and published a lot of articles.
Rinli Ding.
Hello, everyone. I'm Professor Deng. Promote advanced care planning into practice so that push palliative care around China. My contributions have made a profound impact respecting people's autonomy in their decisions and their wishes for end-of-life care.
Ping Ping He.
My significant contributions to health are evident in nursing teaching innovation, international exchange of nursing talents, and chronic disease management. Through my hard work, these three aspects of nursing have progressed relatively rapidly.
Bi-Hoon Hu.
My contribution has significantly improved the benefits and status of nurses in China, strengthened their professional skills, and made it easier for people to access high-quality nursing care via the internet.
Huan Li.
My greatest contribution to nursing is my scholarship and practice focus on improving health and health equity of stroke survivors through person-centered care and mobile health.
Ling Li Li.
My most significant contribution to health include reforming preoperative complication management in orthopedics, advance regional health care equity through medical aid, and enhance students' research skills by innovating nursing curriculum.
Baru Lu.
My contribution is that as leaders in women and children's healthcare, I have enhanced nursing capabilities across China. I have published more than 140 papers and initiated the journal Women and Children Nursing, which disseminates the latest research findings.
Beirong Mo.
Over my 13-year career in nursing, I have committed myself to integrating scientific research methodologies into clinical practice. This approach has significantly advanced China's trauma treatment model and enhanced the comprehensive health management of elderly individuals with disabilities and dementia.
Taiying Shi.
With decades of diligent research and practice in psychological nursing, we improve the experiences of patients in clinical settings, especially breast cancer. The knowledge generated introduced best nursing practice in hospitals across northeastern China, benefiting hundreds of thousands of patients.
Chao Sun.
I've been focused on the function maintenance of the elderly with disability or cognitive impairments. Through assessments, monitoring, intervention, and long-term care supports, I've facilitated the enhancement of the elderly's function, playing an important role of the health aging in China.
Dengmi Wu.
My contributions to research and policy focus on mental health nursing, with a particular specialization in non-pharmacological early interventions for depression in older women and adolescents. By improving access to mental health services, I highlight the nursing perspective.
Li Zhang.
Having created the Trinity Assessment Action Outcome AAO Quality Nursing fast-moving model, through 1,000 technological innovation, I combined quality nursing care with traditional Chinese medicine technology to fill in the gaps, and I innovated the rules of the mobile nurses and the chief nurses of the hospitalization.
From the state of Colorado, Amanda Quintana.
I have had the privilege of working with nursing students, nursing faculty, and nurse leaders across the country to increase nursing workforce diversity. Through my education and coaching initiatives, I have created equitable learning and working environments
by building sustainable, holistic admissions, mentoring, and diversity, equity, and inclusion programs.
Samantha Stonebreaker.
My research has led to several informatics-based interventions that improve the prevention and management of sexually transmitted infections among vulnerable populations. Amplified through teaching and mentoring, my work has led to several policy and programmatic changes that improve health across the Dominican Republic and other multicultural settings globally.
Christy Zuper.
Through my research, practice, and teaching, I advocate for nurse-led innovation and amplifying our community's voices as co-designers. Over 20 years ago, I was the first to bring human-centered design into healthcare in the United States, directly improving care delivery across over 500 medical centers. I remain committed to leading change that is impactful, sustainable, and I'll say it, even joyful.
From the state of Connecticut, Nancy Benesky.
My most significant contribution to nursing centers around reducing health inequities and optimizing the health of children with asthma in underserved communities through transformative changes in practice.
Mary Ann Camilleri.
As a nurse attorney and senior healthcare executive, I created model structures, novel service lines, and community alliances to improve access and top deciles performance. Through my DNP executive curriculum redesign, diverse nurse leaders are propelled to strategic positions in government, systems, and agencies, effectuating change.
Eileen Carter.
My work has propelled academic practice partnerships and advanced nurses' contributions to antibiotic stewardship programs.
Shelley Fetter.
Through my research and work in health policy, I have worked to promote timely access to high-quality palliative care for veterans and other individuals with serious life-limiting illness.
Raquel Ramos.
My contribution has been integral in developing culturally relevant, technology-driven prevention strategies in diverse and marginalized populations living with HIV. Through innovative, community-engaged research, I ensure marginalized voices shape effective interventions that address systemic disparities in healthcare.
Angela Richard Eglin.
My work has impacted health through advocacy and activism on behalf of marginalized groups. I've dedicated my career to initiatives that inform health justice for all and that facilitate equitable distribution of high-quality care and resources.
Christine Rodriguez.
Throughout my career, I continue to have a major impact at the intersection of health equity, religious freedom, and 2S LGBTQ+ healthcare. As an Afro-Indigenous scholar, Two-Spirit healthcare provider, and ordained minister, my work has impacted nursing, religious spiritual education, as well as policy and advocacy, leading to inclusive healthcare models benefiting numerous communities worldwide.
From the state of Delaware, Michelle Collins.
My most significant contribution has been the establishment of virtual acute care nursing as a care delivery model. As an early pioneer, I built relationships with tech companies, initiated ROI work, and shared the playbook nationally. I also established the Virtual Acute Care Network, hosting monthly nurse executive meetings on virtual acute care.
Danielle Sarek.
As a pediatric nurse scientist and health services researcher, my work is focused on improving systems of care for patients and families. My most significant contribution is the creation of the Baby Steps model, a nurse-led transition of care intervention to improve equitable access and outcomes for NICU infants.
From the District of Columbia, Sandra Davis.
Through my work in nursing education, nationally and internationally, I am leading sustainable solutions to advance health equity. My contributions address the critical systemic issues affecting health and invite nurse educators to the table to prepare a workforce focused on closing the gap in health inequities.
Allison Hernandez.
Through my work as a public servant, the most significant contributions that I have made is to promote nurses' civic engagement in policy, so that as a profession, we can continue to impact and influence the policies that affect the health of our nation.
Adriana Nava.
Through my advocacy, I've ensured Latino nurses have a strong voice in Washington, D.C., influencing the policymaking process. As a researcher, I collaborate with healthcare leaders and policymakers to develop HEDIS quality measures, helping to close gaps in healthcare quality.
From the state of Florida, Lori Abbott.
My contribution has impacted health and health equity among rural populations through my research on social determinants of health and implementation of public health interventions to promote well-being and reduce disease risk and exacerbation.
Francine Boneri.
As co-founder and president of the Professional Association Nurses United Against Human Trafficking, our impact has reached a global level. We are dedicated to educating, equipping, and empowering healthcare professionals so that these victims who are accessing healthcare at exponential rates go invisible no longer.
Stasia Booker.
My pioneering research has transformed the study and understanding of chronic pain disparities in underrepresented older adults. I have developed novel pain assessment techniques and culturally provoked interventions for older African Americans living with chronic musculoskeletal pain.
Giovanna D. Oliveira.
As a mental health care provider and researcher, I have integrated my clinical knowledge with my research experience to advance the field of health disparities. I have worked to improve the mental health of minorities by influencing policy at the national and international levels.
Beth King.
My teaching pedagogy, grounded in caring science and innovative practice models of care, have bridged the gap in health equity for rural and medically underserved Floridians. Through a novel online psychiatric mental health nurse practitioner program and the CARE model, a non-conventional mobile health unit, direct access to competent, compassionate, primary and behavioral health care is being provided to thousands of South Floridians.
Yui Matsuda.
My research program is to improve family health. Specifically, my contribution has impacted the health of NICU infants and their families by co-creating the Baby Steps program to support their transition from the hospital to home. Baby Steps has reduced NICU readmission, ED, and urgent care use by over 50%.
Angela Prestia.
My work has informed
influenced, and inspired nurse leaders to create cultures of caring in which staff are valued and patient outcomes are positively impacted.
Natasha Schaefer Soley.
Through my research efforts, I have leveraged nursing science to drive change and promote health and well-being in high-risk worker groups, specifically first responders. As the Deputy Director of the Firefighter Cancer Initiative at Sylvester Comprehensive Cancer Center, I have created a robust program of research and service focusing on cancer screening, education, and survivorship.
Jorge Valdez.
My contributions have impacted health through my advocacy as a nurse anesthesiology educator, clinician, and university administrator. I've dedicated myself to transforming healthcare and shaping a future where patients and nurses from diverse backgrounds have access to high-quality, equitable care and health parity.
Lisa Weesey.
Through my community-engaged nursing research, rural and racially ethnically diverse populations facing increased risk of dementia are being represented. Accomplishments include creating an Alzheimer's disease knowledge survey appropriate for low literacy groups and leading a group of 45 scholars in publishing a State of the Science paper regarding global rural health disparities in Alzheimer's disease and related dementias.
From the state of Georgia, Glenna Brewster.
Through my research, people living with cognitive changes and their care partners have achieved better sleep using scalable dyadic behavioral interventions. Also, the dementia education programs I designed and conducted in St. Vincent have enhanced care practices and demonstrate global applicability.
C. Renee Byfield.
I designed and implemented nationwide programs resulting in the transformation of care delivery models across maternal-child health. Speak Up Against Racism, an equity curriculum and cultural change paradigm has reached thousands of perinatal professionals to accelerate the elimination of disparities by addressing the maternal mortality crisis.
Ethan Cicero.
My program of research improves the health of transgender beings. It served as scientific evidence in Supreme Court cases, which resulted in transgender people being able to serve in the military, access medically necessary gender-affirming healthcare, and protection from employment discrimination. The most notable case set legal precedent that Title IX protections extend to trans students.
Pamela Cromer.
In 2007, I designed the first interprofessional education healthcare for Latino farm workers in Southeast Georgia, the Costa Lehman International Outreach. This summer, we celebrated the 19th anniversary of this program. 7,000 healthcare providers from 14 academic disciplines now provide comprehensive healthcare services for these local workers.
Carrie McDermott.
My contribution to nursing has been to support the transition to practice of new graduate and student nurses. I've done this by advancing competency-based education, redesigning the preceptor model, and implementing novel academic practice partnerships, preparing nurses for independent practice.
Chimonzu Nozichi.
My research focuses on understanding the quality of life and unmet needs of people living with and after cancer diagnosis, and also to develop interventions to address disparities in cancer care and improve cancer care outcomes.
Quinn Fan.
Nursing education practice and service in community-based setting are the cornerstone of my contribution to health. As a former refugee guided by a passion for health equity for the underserved population, my work in building bidirectional sustainable partnership with community partner has resulted in expanded primary care access to thousands in Georgia and globally.
Courtney Pitts.
Through my work, I championed initiatives to improve the overall health and inclusion of underrepresented, marginalized, and historically excluded groups. My work has contributed to national efforts to diversify the nursing workforce and expand access to healthcare by preparing the next generation of advanced practice nurses to serve in resource-limited settings.
David Reinhardt.
Through my work, I focus on education and service, addressing critical nurses shortages, and enhancing perioperative standards of care nationwide. I've collaborated with AORN to initiate an evidence-based perioperative nurse residency program to tackle the scarcity of skilled cardiovascular operating room nurses.
Irene Yang.
Through my research, I investigate the link between oral and systemic health for conditions like Alzheimer's disease and preterm birth. My research will lead to targeted programs and interventions that improve the oral and extraoral health of people experiencing oral health disparities.
From the state of Guam, the Honorable Lourdes Leon Guerrero.
I have improved health outcomes, led Guam out of the pandemic, widened availability of care by passing laws to expand the roles of nurses, provided continuous funding for health programs, created a dedicated agency for services for people with disabilities, and created the first self-insured health program.
From the state of Hawaii, Jill Hogarth Green.
Working directly with our caregivers, our nurses, and our patients in 4 different states has given me the greatest joy as we've improved access, quality, and safety. It's been embracing diversity, equity, inclusion, and social justice, and the work that brings access to all individuals.
Each year, the Academy Board receives nominations for honorary fellowship. These individuals, who have a background outside of nursing, have exemplified interprofessionalism through their exceptional careers. Their induction as honorary fellows signifies their outstanding contributions to healthcare and their collaboration with the nursing profession to advance the health and wellness of the public. The first honorary fellow to be recognized this evening is Kate Judge. Ms. Judd has made philanthropy, let's try this again. Ms. Judge has made philanthropy her life's work. The power to seek the generosity of some to improve the health of many is truly inspirational. Ms. Judge is currently executive consultant to the American Nurses Foundation. Most recently, she was the foundation's executive director, having served in that role for 12 years. During that time, she helped to shepherd the culture of philanthropy within the nursing profession and in turn raised over $62 million to support nurses and advance the work of the profession. When the nation was struggling through the COVID-19 pandemic, Ms. Judge's compassion and commitment for nurses working on the front line of care was at the forefront of the foundation's mission. Ms. Judge launched the Coronavirus Response Fund for Nurses, the the largest public disaster relief campaign for nurses, raising over $30 million over the course of 18 months. Further, the American Nurses Foundation launched a first-of-its-kind survey, the Pulse of the Nation's Nurses Survey, to assess the current state of nursing, give voice to nurses' needs, and to gather data to inform decisions about how to best support nurses during a public health crisis and beyond. The survey revealed the extreme mental health strain, stress, and burden that nurses experience. As a result, to support the nation's nurses, the foundation established a nurse well-being, building peer and leadership support program with funding from the United Health Foundation, among other offerings with philanthropic support. Always recognizing the power of nurses in improving the health of individuals and communities, Ms. Judd is a tireless advocate for raising the visibility of nurses. She served as executive producer for Defining Hope, a documentary by renowned filmmaker and honorary fellow Carolyn Jones. Okay. Which focused on the unique expertise of nurses providing palliative care to patients. The foundation provided funding for the documentary to be shown on PBS and developed corresponding video learning modules that have been widely viewed. Moreover, Ms. Judge orchestrated the Reimagining Nursing Initiative, which was designed to challenge current assumptions about nursing practice and test new approaches for the future. This $20 million program has already distributed more than $14 million in grants to 10 organizations. It is our honor to recognize and celebrate the incredible contributions of Ms. Kate Judge to the nursing profession. Ms. Judge, Kate, can you join us at the podium?
I want to thank the Academy for this very unexpected and very, very special award. I have spent my lifetime shining the light on you, so this is not like my comfort zone right now. I will just say that. I want to thank my family first and foremost, who really have shared my love for nursing these last 30 years. My husband Steve's here and my daughter Madeline. I owe you thanks. I think actually the profession owes you thanks because you enabled me to prioritize them constantly, sometimes not so much the things at home. I've been granted the real honor of working with all of you alongside you because 2 nurses hired me. The first is living legend Norma Lang, without whom I never would have known who you were and why you're so special. And the second was the visionary Marley Weston, who really shared with me the larger world of nursing that hopefully I could help with. My deepest gratitude goes to the nurses who raised me. So many are in this room, but a real shout out to the Penn nurses who Penn Nursing, who really brought me up. Eileen, right? Tony, I know you're here. I think Loretta's here. Special shout out to Neville Strumpf and Joan Linow, Karen Bueller-Wilkerson, and the late, great Claire Fagan. At the Nurses Foundation and in ANA, I worked with dedicated staff and volunteers, nurses and nurse advocates who were driven to make the world better through nursing and for nurses. And many of you are here tonight. I know one of them is getting inducted, Jennifer Gravy, Christine Pavico is here, volunteers like Rhonda, others that are here. I want to thank you, a real shout out to one supporter, Kim Harper, and to Carolyn Jones and Lisa Frank, who are back out there, who have done such extraordinary work in bringing the rest of the world into the conversation about why nurses are important. I want to thank 4 special, very, very special people at the American Nurses Foundation that work so closely with me. The first is Joyce Fitzpatrick, a fundraiser's dream collaborator and friend. Joyce, where are you? Somewhere brilliant. The second is Tim Porter O'Grady, who inspired and enabled the creation of Reimagining Nursing with the remarkable support of CEO and nurse Greg Adams of Kaiser Permanente. Willie Manzano, who led as president while she was on the ground leading NYP's response to the pandemic. How generous is that? And Kathy Driscoll, who is one of the smartest nurses I know and the kind of nurse that we really need in corporate healthcare. For this nomination, I want to thank Joyce and Tim, the legendary Karen Daly, the extraordinary Kathy Malik. I'm really being recognized for much of the work that I did with Tim. Tim, you are a nurse leader who so completely inspired me and listened underneath the surface of what I was saying or doing to know just what I needed as a human being to go further and faster. And going further and faster for nursing is imperative because the stakes are so high. And I have to say that one of the things I learned over the last 30 years, and humbling to learn this, is that nursing isn't asking for enough. Today, yes, Bev, right? Today we heard a great session on the economic value of nursing. And one of the things that Olga said was, you know, nurses, you're gonna have to do this. And it's absolutely true that the big, bold thinking that Byrne was talking about has to come in great part from the nursing profession, and we need to be bigger and bolder and expect more, because absolutely, if there's going to be healthcare in this country that is really about health and equity, nurses are going to lead it, and it's going to take resources. So what if nursing didn't get 1 penny, because that's what nursing gets right now in philanthropic support in the greater scheme of things, 1 penny for every $1 that's given away. What if nursing got 4 cents or 5 cents? What if the people in this room had $5 billion a year, every single year, to invest in health and equity, right? That is the world that should be, and that's the world that you all, as members of the Academy, especially the new inductees, and now me, we all can do. So I want to thank you again for being able to talk about you for the last 30 years everywhere that I've gone, for calling so many of you friends. I truly love you all. Thank you. Do I come over there too?
From the country of Hong Kong, Cao Ming Chow.
Contribution is seminal research on sexuality care for female cancer patients, which inform your practice in clinical settings and improve the betterment of patients. I also advocate curriculum design and promote interprofessional education to nurture a new generation of nurses.
Rick Kwan.
The most significant contributions I've made to health is using digital technology to develop health promotion interventions that enhance the physical and cognitive health of older adults. Additionally, I have developed educational methods to provide new and more efficient learning experiences for nursing students.
Jojo Yang Yang Kwok.
I made significant contribution to establish compassion-focused care for Parkinson's disease by leveraging cutting-edge implementation trial designs. As a nurse educator, I bring my passion on compassionate care to our next generation of nurses. Compassion is always in action for our wellness and for our profession.
From the state of Illinois, Anne Abraham.
My contributions have significantly impacted health by improving access to care through strategic initiatives such as increasing bed availability and securing a robust workforce. My efforts in promoting health equity have strengthened our healthcare system's ability to serve diverse communities effectively.
Elizabeth Aquina.
I have championed diversity and equity initiatives for health, access, and representation. As the founder of the Nurses Running for Elected Office Training Academy, I have helped to empower nurses with the knowledge, support, and network to confidently run for elected office at all levels of governance.
Beverly Hancock.
I have developed comprehensive programs and opportunities designed to advance leaders across all nursing roles. These initiatives equip nurses to realize their potential to improve health through exceptional nursing care, ownership of practice, and influential leadership, ultimately enhancing health outcomes.
David Hansen, in memoriam.
I taught 28 frontline critical care nurses in a 16-month leadership and change agent program. These teams tackle some of patient care's most problematic and costly challenges. I'm pleased to share that all 28 nurses graduated from the program, and I'm even more delighted to share that their efforts combined saved an estimated $8 million for the 7 hospitals involved in the program.
It is with great sadness to inform the fellowship that David Hansen passed away in May this year. I know many fellows were friends and colleagues of Dave and remember him fondly. His niece Kayla was looking forward to attending the induction ceremony and the soiree with her uncle to celebrate this milestone. We wish they both were here with us tonight. David was the former director of program strategy and partnerships at the Society of Critical Care Medicine and served as the 38th president of the American Association of Critical Care Nurses. Mr. Hansen championed the value of diversity, equity, and inclusion in the workplace, pushing for every voice to be heard. I would like to recognize and thank David's sponsors, 2 former Academy presidents, Karen Cox and Angela McBride, for their support in recommending him for a fellowship. In her sponsor statement, Dr. Karen Cox remarked on David's most dramatic improvement in care. She shared that medication errors sickened several neonates and resulted in 3 deaths. These babies had received adult amounts of heparin, not pediatric dosages, and Dave was asked to lead nurse pharmacist teams that eventually developed system-wide practices for eliminating distractions during medication administration. His approach to medication dispensing would revitalize critical care nurses' commitment to patient safety nationally. A crucial outcome of his analysis of the medication errors was that the realization that adult and pediatric packaging of heparin looked very similar. This risky situation was brought to the attention of the drug company and result in a life-saving product redesign. Let us pause and hold a moment of silence to recognize Dave Hansen, a fellow of the American Academy of Nursing. Now, to continue with our remaining scholars from the state of Illinois, Julie Hoff.
In my work, I leverage data-driven insights and forward-thinking approaches to increase access to nursing education, strengthen the nursing workforce, develop novel academic practice partnerships, and drive health equity-focused research and innovation to improve health outcomes and access to care.
Cynthia LaFawn.
My contributions include the conduct and translation of research at international and national practice settings to improve children's pain management, prevent patient falls, and address disparities in hospital-acquired pressure injuries.
Hong Jin Lee.
My research has been dedicated to developing and implementing acupuncture intervention to enhance health equity in symptom management in underserved breast cancer survivors and advocating public and private insurance coverage for this treatment.
Jenny O'Rourke.
As a leader in simulation pedagogy, I have partnered with national and international organizations to generate simulation knowledge and standards. During the pandemic, I led a team of 50 nursing faculty from across the country to build a telehealth toolkit for advanced practice nursing, and I disseminated a database of virtual simulation.
Bina Peters.
My primary contribution to health is designing innovative healthcare solutions that integrate human-centric design and automation to optimize health for vulnerable, underserved populations.
Monique Rydosh.
I have advanced the science of self-management and quality of life in people living with spina bifida. My research on instrument development and self-management trajectories has laid the groundwork for novel family-centric models of care. My advocacy for self-management as a research priority impacts the disability community nationally and globally.
Tanya Sorrell.
I've developed clinical research that increases access and outcomes for the underserved. I train people in the Chicago public school system in substance use education, and I provide testimony and advocate as the first nurse on the board of Cook County Health. Saving lives, that's what I do.
From the country of India, Sarish Sharma.
My significant contribution as a nurse academician is to ensure quality of nursing education in my country by authoring top quality nursing textbooks and adapting renowned international nursing textbooks in South Asian context. My research focuses on scope and barriers in implementing advanced nurse practitioner cadre in India.
From the state of Indiana, Elizabeth Richards.
As a public health nurse and disciplinary expert in health behavior change, I create health promotion programs reaching diverse and under-resourced populations. Partnering with Cooperative Extension, I translate my research into lasting, community-based programs impacting population health.
Vicki Simpson.
Throughout my academic and research career, I have engaged with communities to support development of sustainable community networks which enhance health promotion and disease prevention and improve population-level health outcomes.
Jane Von Godeker.
My contribution has been in addressing healthcare disparities in underserved regions. Leading an NIH R01, I work with a multidisciplinary team to improve access to epilepsy care in Western Kenya. And as a nurse leader, I foster exchange of knowledge among nurses globally to improve patient care outcomes.
From the state of Iowa, Wen Lu.
My contributions impact health through developing valid and globally accessible measures to elucidate dyadic mutant interactions and creating innovative person-centered interventions to optimize quality of mutant care and outcomes for people living with dementia and their caregivers across care settings.
Sosa Tolerica.
My contributions have focused on reducing dementia risk. Through research, I've demonstrated the impact of stress on brain aging, revealing biological pathways through which psychosocial factors impact dementia risk. This evidence has elevated the nurse's critical position in promoting dementia primary prevention.
From the country of Ireland, Georgina Gethin.
My research and advocacy work not only promotes the role of the nurse, but has also informed national and international policies and clinical practice guidelines. In University of Galway, Ireland, I'm part of a vibrant research network dedicated to developing innovations to promote healing and improve the lives of those impacted by wounds.
Katrina Heffernan.
My significant contribution to healthcare is focused on designing educational programs that infuse leadership theories and concepts to strengthen and amplify advanced nurse practice both nationally and internationally.
Natalie McAvoy.
My expertise within the Irish healthcare system focuses on research that improves outcomes for critically ill patients, specifically in preventing healthcare-associated harms, including pressure injuries. As an elected leader within national critical care nursing organisations, I am passionate about empowering nurses to generate high-quality evidence that positively impacts patient outcomes.
From the country of Italy, Rosario Caruso.
Starting from Italy, I secured substantial funding for the nursing research, developed evidence-based clinical guidelines, and led networking initiatives that have been scaled up internationally. These efforts have improved nurse intensive patient care in cardiovascular and cancer care.
From the state of Kansas, Kara Bisonhart.
I have combined innovation and evidence-based teaching to prepare a highly educated NP and midwife workforce ready to care for individuals in rural, urban, and tribal underserved communities. As a statewide leader in midwifery and advanced practice, my contributions were integral to Kansas advanced practice nurses achieving full practice authority in 2022.
From the state of Kentucky, Luce Huntington Moscos.
Through my work as a community engaged nurse scientist, I focus on translation and dissemination of environmental health research for communities. My research impact is centered on the science of report back, spanning adolescent health, environmental health, and technology-enabled approaches to provide data for personal and community action.
Linda Robinson.
I spearheaded efforts to combat workplace violence in healthcare, created coalitions, securing landmark legislation. As founder of the global podcast PX Space, I've amplified healthcare voices in 49 countries. My impact is creating lasting, meaningful change.
Taval Kendall.
My contribution to clinical practice, education, and health policy has positively influenced health outcomes and affected the lives of thousands of patients, citizens, and health professionals. As an expert in HIV clinical practice and as an invited consultant, advisor, speaker, educator, commissioner, and nursing regulatory professional.
Mary Dios Ramos.
I led professional development programs and created a toolkit to reduce caregiver burnout and improve care access. This evidence-based approach helped families nationwide and boosted caregiver use of community resources. I've shared my dementia research globally through publications and presentations.
From the state of Maine, Cheryl Nimmo.
I led the team that obtained the removal of physician supervision of APRNs in Rhode Island. I have provided academic and role model leadership and advocacy in the education of more than 300 nurse anesthesiologists who provide clinical expertise in rural New England.
From the state of Maryland, Christine Better.
Through my work, I provided policy direction on strategic healthcare initiatives with global impact for warfighters, beneficiaries, and veterans. I am currently creating the first military health system digital transformation strategy to develop an enterprise approach for the digitally enabled workforce.
Sabrina Barros.
My contribution to nursing in healthcare as a leader in the development of simulation educators led to the first evidence-based curriculum model that continues to guide professional development across the globe. Through service and scholarship, my work drives sustainable change for policy recommendations in simulation practice and research.
Jennifer Graber.
My contributions are related to workforce development and creating innovative pathways for advanced degree attainment for nurses, but also in talent pipelines for entry into the health professions. I've also studied the impact of accredited professional development on interprofessional collaborative practice and the care of patients who are experiencing human trafficking.
Melissa Holodeck.
My influence lives at the intersection of aging, health equity, and strength, shaping healthcare systems, research, and providers to contextualize older adults' multimorbidity with their lived experiences and values. This has led to influencing aging policy in the US and Latin America and refining clinical practice of over 22,000 practitioners worldwide.
Danielle McAmee.
I build communities that create opportunities through networking, mentorship, and advocacy. My impact in nursing has emerged as a transformative force within the profession by creating inclusive spaces where DNP-prepared nurses of color can feel seen, heard, and valued, so they are able to thrive in their respective spaces where they might be the only one.
Kim Mooney Doyle.
Nearly 500,000 families love and care for a seriously ill child. I impact family healthcare policy and research through partnership with parents and siblings to uncover and address their overlooked experiences.
Gregory Raymond.
Whether serving as Chief Nursing Officer for the Baltimore Convention Center Field Hospital, considered a national exemplar during our pandemic, or advocating for nurses around issues like destigmatizing substance use disorder and addressing workplace violence, I am constantly focused on policy and practice solutions that benefit both patients and nurses in my state of Maryland.
Cynthia Rubio.
My nursing practice has encompassed the Air Force, the private sector, and the U.S. Public Health Service. I've influenced health through patient care and disasters, working underserved communities, and being a prevention leader.
Lori Seleknik.
My contribution has been on highlighting the role of perioperative nurses in healthcare and the value they bring to the multidisciplinary team, especially in the area of patient safety. A perioperative nurse whose practice is evidence-based is essential in what's needed for our patients that are at their most vulnerable. A healthy, supportive work environment will ensure the availability of perioperative nurses well into the future.
Franz Vergara.
I have made significant contributions to health equity by pioneering a California case management program and demonstrating sustained service in orthopedic nursing. Nationally, my programs supported transitions of care for marginalized populations, enhanced patient engagement, and reduced healthcare utilization.
Susha Ballat.
My most significant contributions include advocating for LGBTQ+ rights, shaping inclusive policies, and decolonizing higher education. I'm very proud to have led initiatives in the Middle East and North Africa, fostering equitable healthcare environments and influencing policy change to advance global health equity.
Changok Choi.
My contribution to health focus on health disparities and promote self-management of chronic disease outcome using a tablet-based cognitive behavioral intervention. My work also focused on improving mentoring practice through a mutually beneficial partnership approaches.
Jessica Dillard Wright.
Imagination is a fundamental prerequisite for well-being and liberation. My work makes space for alternate healthcare futures through dreaming, capacity building, and prefigurative ethics for a more just, equitable world. For me, that world includes a free Palestine, healthy communities, the end of capitalism, fed children, well families, no war, housed people, health justice. What do you dream of?
Priscilla Gazarian.
Through my work as a nurse scientist and educator, I lead innovative research aimed at improving the quality and safety of healthcare among persons with serious illness. I have led national efforts to improve the uptake of advanced care planning, and I have impacted national health policy.
Clara Gona.
Through research, I promote health equity by addressing cardiovascular disease risks in African immigrants in the US, and I have influenced health policy for women living with HIV in Zimbabwe. Through collaborations with the Global Burden of Disease Study, we have informed health policies affecting over 600 million people in Southern Africa. Additionally, I have mentored the next generation of nurse leaders and researchers locally and internationally.
Joan Mehanir Sham.
I'm a national and international expert in advancing access to sexual assault nurse examiners, or SANES, for patients of all ages and genders. I piloted the first national telenursing center to export SANE expertise to patients in remote and underserved communities. My life's work in nursing has given voice to thousands of survivors of sexual assault and human trafficking.
Jin Hee Park.
My research focuses on improving infant and child health by addressing eating problems in vulnerable infants and supporting families with complex care needs. My work has enhanced health outcomes through new discoveries, innovative interventions, and reliable assessment tools in feeding research and practice.
Memnon 7.
The most significant contribution to health I have made is to make substantial progress toward prevention and screening of cancer, and to bring health equity specifically for those affected by cancer by addressing food insecurity and other social needs affecting health and health behaviors.
Brittany Vanderwater.
Through my work in tuberculosis research and building nurse capacity in sub-Saharan Africa, I'm strengthening communities, health systems, and global health research. My TB work will impact over 20,000 individuals in South Africa. In parallel to this, and alongside colleagues, I developed a novel precepting program for midwives and nurses in Sierra Leone and Malawi.
From the state of Michigan, Miriam Cabral Stevens.
My contribution as a community-engaged researcher is increasing disaggregated data on the heterogeneity and burden of cardiovascular disease amongst specific Asian subgroups, hence debunking the model minority myth. This increased disaggregated data will lead to increased resources that will address the inequalities experienced by Asian Americans.
Tony Glover.
My contributions to health have been in pain research and helping nurses to achieve primary palliative care competencies.
Dawn Goldstein.
My contribution addresses mental health equity by providing care to marginalized groups and training over 500 psychiatric nurse practitioners. With $3 million in NIH and state funding, I've expanded addiction prevention efforts to minority physicians and nurse practitioners. My legislative work on mental health parity underscores my national influence.
Kathleen Pondexter.
My greatest impact is on nursing workforce development and excellence in education. I accomplish this through transformative educational strategies to prepare a competent, resilient, and diverse workforce. The co-creation of sustainable workforce solutions through the lens of social justice promotes health equity while courageously dismantling long-standing educational norms.
Kathleen Schachman.
My work has significantly improved health by enhancing access to addiction and mental health care in rural areas. Through innovative educational programs and the creation of specialized clinics, including mobile services, I've expanded rural treatment access. These efforts have also strengthened the rural healthcare workforce, promoting sustained, high-quality care and advancing health equity.
Our second honorary fellow to be recognized this evening is Dr. David Vance. An internationally renowned scholar in neuropsychology and neurocognitive aging, Dr. Vance's contributions have advanced the science of healthy aging and treatment of individuals living with the complexities of the HIV disease, as well as other chronic conditions such as cancer and Alzheimer's. Dr. Vance's pivotal research on aging, cognitive processing, and cognitive training provides empirical and evidence-based recommendations for treatment guidelines used by clinicians caring for aging persons with chronic conditions facing neurocognitive decline to achieve optimum quality of life. His scholarly work has far-reaching global impact and has been widely distributed in nearly 400 publications and throughout over 750 presentations across 25 countries and territories. Dr. Vance is currently the University Professor and Director of Grant Regulatory and Review Processes at the University of Alabama Birmingham School of Nursing. Over the course of his career, he has served as a mentor and research partner, creating lasting interdisciplinary partnerships, particularly with nurses. He was the founding editor of Nursing Research and Reviews and has served on several editorial boards, including Research in Nursing and Health and the Journal of the Association of Nurses in AIDS Care, for which he was the first professional outside of nursing to serve in this role. Having a significant impact on policy, Dr. Vance's work in cognitive training has contributed to developing treatment guidelines for cancer survivors with chemobrain, which are provided through Medicare in over 40 states. Dr. Vance has helped shape the federal research agenda as an invited attendee to the White House's first Forum on Aging with HIV and has participated as an invited member of the NIH think tank on HIV and aging, sponsored by the Office of AIDS Research. Dr. Vance's contributions have also led to the adoption of clinical guidelines for screening and interventions associated with neurological disorders and impairment changes clinical guidelines for neurocognitive screening. This groundbreaking work has led to the implementation of these guidelines in the federal Ryan White program that serves 50% of the nation's HIV population. We are delighted to honor Dr. Vance. He is a partner within the profession who recognizes the vital importance of interdisciplinary efforts to ensure the health and wellness of those with the most chronic conditions. I'd like to invite Dr. Vance to the stage.
Seated, thank you. I'm speechless, but now I have to give a speech, so I'll give it a go here. So by 2030, nearly 70% of people with HIV will be 50 and older. To some, this may seem daunting. How do we care for such people? What mental and physical problems will they have? But for me, these questions are uplifting. They tell us how far we've come from dying with HIV to actually thriving with HIV. Thank you. Now, my convoluted journey into nursing started in the 1990s when I was diagnosed with HIV. My HIV counselor at the time said, hey, you can live up to 5 years. I was in a PhD program that would probably take me 5 years. That's not how I wanted to spend my time. So I was really nervous, so checking in with my healthcare providers gave me hope when I was scared. And fortunately, there was one seasoned nurse with her calm and sturdy demeanor who recognized my fear. David, she said, something will kill you, but it won't be HIV. So, what a wonderful thing to say to someone, something will kill you, but it won't, yeah. But that's what I needed to know. And so fast forward to today, and here I am, still standing, still thriving. And I just want you to know it's been an absolute privilege to dive into the study of successful aging with HIV. Now I'm a gerontologist, a long-term survivor, and naturally I'm an advocate for this incredible community. Teaming up with brilliant nurses has propelled my work on cognitive aging with HIV and other conditions. And together we've helped shape clinical guidelines for adults with HIV as they age. Basically, I'm helping make sure people like me aren't just aging, we're aging fabulously. So as a nursing ally, friend of Sigma Theta Tau, and educator of nurse scientists, it has been an honor to work alongside nurses to advance science and policy. And with that, I have a lot of thank yous. So first to Dean Doreen Harper for taking a chance and hiring me back in 2006 as the first non-nurse faculty member in the UAB School of Nursing. Second, my fan sponsors and team for making this happen, Dean Maria Shirey and Drs. Marie Bakaitis, Ellen Smith, Jason Farley, and James Raper. Third, to my friends at the Association of Nurses in AIDS Care, ANAC, for just being their awesome selves. Thank you so much. Fourth, to NIH for continuous funding of my research. Fifth, to my many colleagues, friends, and especially my family, Mom and Dad, who have been cheering me on ever since even if they don't really understand what I do for a living. Special thanks to Dr. Perry Fazeli, my friend, colleague, and academic niece. We have fun with science. And 6, to my best friend and partner, Paul Durham, and our cats, Jasper, Bandit, and Fenwick. You are my home. Thank you. And finally, thank you, American Academy of Nursing, for this award. To be counted in the Fellowship of Nursing is a privilege, one that I will incorporate into my ongoing passion of successful cognitive aging. So many, many thanks.
Thank you, Dr. Vance. From the state of Minnesota, Robin Austin.
My contribution has centered around the integration of data-driven technology, person-centered care, and whole person health principles to foster an innovative approach to health and well-being. Through my research, I create and advance whole person health digital solutions to leverage individual and community resilience.
Rhonda Kazak.
I have created a comprehensive roadmap to solve for nursing workforce challenges, including innovations such as nurse retentionists, flex path orientation, and the nursing playbook. Ensuring a healthy, thriving nursing workforce optimizes the health experience for all.
Heidi Lindroth.
Delirium is a typical acute brain dysfunction that doubles the risk of dementia. My research has moved us to address delirium severity, and I've developed automated tools to help personalize interventions to mitigate delirium severity. Together, we can achieve a world without delirium.
Holly Shaw.
For nearly 2 decades, I've represented nursing at the UN, where I've advanced health knowledge and priorities among diplomats, leaders, and policymakers, amplified the voice and stature of nurses worldwide, and contributed to a robust, sustainable, and influential global nursing workforce.
From the state of Mississippi, Kayla Carr.
Through academic practice partnerships, I've challenged traditional models and policies to advance health equity for vulnerable and underserved patients, bringing primary and mental health care to thousands of children and their families in their own communities through nurse-led school-based clinics, mobile units, and telehealth practices.
From the state of Missouri, Elizabeth Monsey.
My career is dedicated to the prevention and control of healthcare-associated infections and promoting safe antibiotic use. My research on these topics have advanced policy and practice. Education that I've conducted internationally helps nurses lead the successful implementation of infection prevention and stewardship programs.
From the state of Nebraska, Martha Todd.
The most significant contribution to health I have made is through my research and competency-based assessment. The Creighton Simulation Evaluation Instrument and the Creighton Competency Evaluation Instrument have been used extensively in nursing education to assess student performance in both traditional and simulated clinical environments.
From the state of Nevada, Alexis Curtis.
My work has expanded access to quality healthcare services for underserved rural populations through APRN-led practice innovation, academic leadership, research, and policy advocacy.
Raymond Serafico.
My primary contributions have revolved around addressing the healthcare needs of immigrants using a transcultural framework through collaboration between healthcare providers and community stakeholders through practice-based research networks in the state of Nevada and beyond.
From the state of New Jersey, Emilia Iwu.
The best part of my work in the last 2 decades is really working with nurses, building their capacity to provide high-quality HIV care for families affected by HIV, and working with adolescents to build their capacity for disclosure, and finally advocating for advanced practice nursing in Nigeria.
From the state of New York, Veronica Barcelona.
I am a maternal health nurse scientist committed to effecting social change through my research. I study how interpersonal and structural racism drives perinatal health disparities. My vision is that every mother will welcome her baby in an environment of respect, care, and love.
Melissa Bolchamin.
I'm a cancer care delivery nurse researcher focused on improving equitable care delivery for young people with cancer. Through my work, I identify and address financial toxicity and unmet health-related social needs that are associated with poor health outcomes.
Dewey Brown DeVoe.
My contribution to increase diversity in executive leadership has significantly impacted healthcare by improving decision-making through diverse perspectives, promoting support and role models for underrepresented individuals, promoting inclusive organizational culture, and addressing healthcare disparities and advancing health equities.
Jane Dickinson.
My research established that negative messages in diabetes care are problematic and lead to distrust, lack of motivation, and isolation. Through my work, health professionals have awakened to the importance of person-centered, strengths-based language, and we now have clinical guidelines and standards of care in the U.S. and language guidance papers internationally.
Ashley Graham Burrell.
As a leading authority on Black nursing history, my contributions transform how we view and share this vital field. My expertise as a nursing historian with a mastery in racialization in nursing furthers my commitment to combating racism in healthcare. Through oral histories and innovative curriculums, I am reshaping nursing history to advance health equity.
Heidi Hahn Schroeder.
My proudest contribution to nursing has been spearheading policy through academic service partnerships to promote health equity. These efforts have reshaped national and international strategies to produce practice-ready nurses that transform health.
Tara Hegel.
I led a team of disaster nurse researchers to develop a global disaster preparedness tool. Our instrument is used worldwide to assess preparedness and intervention effectiveness across diverse populations. Additionally, I was consulted by the U.S. Senate Special Committee on Aging as an emergency preparedness hearing witness to support the bipartisan Ready for Disasters Act. I had the honor of providing written testimony for the congressional record.
Shirley Magnus Normalus.
My current research focuses on examining the societal factors that influence behavior change among Haitian immigrants with type 2 diabetes and developing culturally relevant interventions. I am advancing health equity by leading multidisciplinary population-focused studies, thus contributing to the clinical and scientific understanding of health disparities.
Margaret McCarthy.
My research on physical activity in high-risk, vulnerable populations aims to improve overall cardiovascular health. Given my background as both a family nurse practitioner and an exercise physiologist, I have successfully integrated the electronic assessment of physical activity during clinical office visits, prompting healthcare providers to counsel patients on physical activity.
Rebecca Owens.
My most significant contribution to health has been through my work in an innovative mindfulness practice, holistic palliative care initiatives, and a 3-minute video during COVID for over 5,000 clinicians worldwide.
Darcel Reyes.
My mission is to help people with HIV achieve health equity through research and service. Through progressively responsible leadership positions, I have trained and supported HIV nurses both in the U.S. and globally.
Lydia Rotondo.
Through my advocacy work, I have advanced DNP education and simulation-based learning in nursing programs throughout New York State. I have developed innovative nursing education models that create empowering learning environments and prepare practice-ready graduates to deliver high-quality care and navigate complex healthcare settings.
Tina Sonda-Rinkany.
I advocate and innovate to advance equitable care for underserved older Americans in adult daycare centers. I've implored agencies like the U.S. Department of Agriculture to reevaluate unjust nutrition policies that undermine the health of diverse older Americans in these centers, and created a novel app called CareMobi that day programs and caregivers can use to engage with health systems.
Marcia Sinanan.
My contributions have been practice and policy changes to advance transcultural nursing, global health, health equity, as well as supporting nurses of color in the workforce after racism experiences within the acute care center.
Daniel Smith.
My work is fueled by a deep concern for the planet and its inhabitants, particularly those most vulnerable to climate change. This has led to the development of worksite protocols to protect outdoor workers from occupational heat stress and heat-related illness across the United States and Latin America.
Andrea Sonnenberg.
As a certified nurse midwife, educator, health services researcher, and registered lobbyist, my contributions have been to promote advanced practice nurse roles in the Americas and the Caribbean, improving equity, access, and quality of care. Partnering with nurse scholars in the U.S., Brazil, Haiti, and Colombia, my impact has been promoting health in the Pan-American region.
Edgewood Thomas.
As a health equity advocate, a healthcare innovator, and an educator, my social justice passion was ignited by my parents. I've scaled evidence-based care models addressing healthcare disparities in the New York Medicaid district program, and now I'm focused on addressing health disparities in maternal child care.
Jasmine Travers.
Through my research, testimonies to Congress, and work on the National Academies of Sciences, Engineering, and Medicine's Committee on the Quality of Care in Nursing Homes, along with AARP, I have made significant improvements in nursing home staffing, equity in care for older adults, and supports for overworked caregivers.
Fabian Ulysses.
As a doctor of nursing practice, my contribution is founding Compassionate Health Ministries, a not-for-profit organization leading a multidisciplinary team committed to advancing health promotion and disease prevention in underserved communities in the United States and abroad.
Kenya Williams.
I've significantly impacted health by mentoring student nurses and partnering with faculty members across all academic levels to implement innovative educational programs. These programs promote professional and leadership development, preparing our future colleagues to influence and advance healthcare outcomes globally.
Linda Ziemund.
Noteworthy contributions to our profession have been in strengthening the nursing workforce.
This work includes transforming onboarding education within organizations and scaled academic practice partnerships for pioneering changes to improve RN preparedness to work in specialty practice areas.
From the state of North Carolina, April Braswell.
As an international consultant for Catherine Kolkava's Comfort Theory, I've worked with nurses, students, professors, and researchers on 5 different continents across the globe. My significant impact as a nurse practitioner, scientist, and educator revolves around establishing measurable and equitable holistic comfort care for vulnerable infants, children, and adolescents.
Nancy Crago.
Through service, research, and education, I work to improve health equity in underrepresented populations like those with sickle cell disease. My research focuses on current needs of people with sickle cell and health system factors that contribute to poor outcomes.
Jean Davidson.
As a family nurse practitioner, I've dedicated my career to improving global health equity. I've established free clinics here and abroad, educated hundreds of healthcare providers, and led interprofessional medical missions.
Robert Dodge.
Over the last 3 decades, my contributions to nursing and healthcare have focused on improving access to care and reduce health inequities among LGBTQ and other marginalized populations at risk for infectious diseases. Also, I have facilitated healthcare innovations that strengthen policies and guidelines that support HIV service delivery.
Rhonda Foster Smith.
My impact is in the areas of advocacy and innovation. One tutoring program resulted in 26 years of service learning at Bowling Green State University. And one cereal drive yielding 70,000 servings has resulted in 21 organizations embracing it, yielding 19 million servings, feeding children in the summer.
Kelly Griggs.
As a champion for equitable maternal health care for vulnerable and underrepresented populations, my contributions include promoting respectful care, raising awareness through shaping policies, position statements, and national legislation. I believe in the transformative power of nurse-led advocacy to reduce barriers to improve health care.
Michael Jones.
In my 24-year nursing career, I have improved health equity and strengthened nursing capacity regionally and nationally through sustained leadership in state and national organizations that focused on improved access to quality healthcare services and access to nursing education for underrepresented populations.
Allison Lewinsky.
My contribution to health focuses on how to optimize virtual care resources and services for equitable healthcare delivery for adults with chronic illness. I develop and implement evidence that improves health outcomes and optimizes healthcare delivery for the system, and improves processes and technologies within the healthcare system to improve virtual care across the care continuum.
Devon Noonan.
My contributions have been in community-engaged development and implementation of public health practice models that have increased the reach and access of substance use prevention programs. As an embedded public health nurse researcher in rural North Carolina, these prevention programs have been implemented and disseminated to decrease substance use across the state and nationwide.
Han Sung Woo.
The most significant contribution to health that I've made was through my research. By leveraging the excellence of data and social innovations, I've generated actionable knowledge to reduce health inequity faced by older adults both in the United States and worldwide.
From the state of Ohio, Mary Anthony.
My research has advanced nursing by connecting practice models to patient and nurse outcomes, contributing to national guidelines on delegation. In practice, I developed and strengthened the research to practice link by mentoring clinicians, which tripled the number of clinical nurses active in research.
Patricia Bondurant.
In my role, I dedicated myself to improving the care and outcomes for neonates, children, and adults through data-driven quality improvement work. My work has driven systematic improvement in many high-risk patient populations. My commitment to data-driven quality improvement serves as an unwavering foundation for our shared goal of providing exceptional care to every patient, every time.
Evelyn Duffy.
As a leader in gerontological nursing education and practice, I address the need for advanced practice nursing care of complex, diverse older adults, leading local and national educational practice and policy initiatives that enhance gerontological expertise and advocate for removal of barriers to practice.
Christine Fortney.
My greatest contribution to nursing is research focused on infant symptoms, care experiences, unmet needs, and parent distress and coping in the neonatal intensive care unit. Through this work, I am filling crucial knowledge gaps for seriously ill infants and their families.
Shannon Gillespie.
Through my work as a nurse scientist, I design and lead research addressing the social and psychological determinants of maternal infant health. I've developed a novel immunomonitoring method to predict and prevent perinatal complications and work to evaluate and scale up an integrated model of postpartum primary care. Together, such efforts aim to reduce maternal and infant mortality and promote health equity.
Jacqueline Howing.
My health influence has been the power and passion of sharing an evidence-based cognitive behavioral skills building intervention and disseminating the research outcomes of reducing stress, anxiety, depression, suicidal ideation, and promoting optimal well-being and mental resilience among diverse populations.
Erica Steed.
Through my work and by using my singular voice, my personal experience, and my position as a nurse CEO, I've relentlessly driven an urgently needed new national conversation about health equity, one that moves beyond just empathy and concern to immediate action to eradicate health disparities.
From the state of Oklahoma, Judy Goforth Parker.
I have demonstrated commitment to improving the health of First American communities of the United States. My contributions as an academic nurse leader, healthcare executive, elected tribal legislator, policy advisor, and advanced nurse practitioner have inspired generations of nurses.
Shelley Wells.
My work focuses on increasing access to healthcare by developing policies, programs, and strategies to increase the numbers of nurses and advanced practice nurses available to safely provide care in rural and underserved communities. My work's provided exemplars for development in other areas as they work to increase their access to care through nursing practice.
From the state of Oregon, Lori Criddle.
My life's work has been advancing the care of injured patients by giving trauma nurses the life-saving knowledge, tools, and confidence needed to manage this challenging population. TCAR Education Programs has delivered high-quality, comprehensive, and accessible trauma training to nearly 90,000 bedside nurses in the U.S. and around the world.
From the state of Pennsylvania, Rebecca Clark.
My science is building the foundation for understanding how investing in hospital nursing organizational resources improves maternal and infant health outcomes and differentially benefits women from marginalized communities to achieve health equity. My work has impacted health by informing research nationally and internationally, professional organizations' research and policy agendas, and clinical practice.
Jill DeMercy.
My significant contributions have been in research, education, and service in areas of maternal child health, and specifically in advancing lactation and breastfeeding support for birthing people and families, for more personalized and preventative and more creative models of care, and specifically in the areas of remote technology-based support.
Luis Jakubek.
As a nurse, entrepreneur, and innovator, my impact is to advance excellence in nurse credentialing among generalist nurses. My impact extends to individual nurses, hospitals, and healthcare systems through a substantial library of developmental tools for certification preparation.
Anna Schoenbaum.
I have leveraged my clinical informatics and IT expertise to reimagine healthcare by creating opportunities for innovative digital transformation. These groundbreaking innovations focus on improving care delivery, promoting health equity, and enhancing clinician wellness, ultimately transforming the healthcare landscape.
From the country of Singapore, Shafuli Shori.
My most significant contributions are through my research to support women's and children's health. Especially, I have developed psychosocial interventions to improve perinatal care, to support parents in impacting and enhancing their overall well-being and providing best start to the children, the future of our society.
From the country of South Africa, Portia Jordan.
My contribution to health improvement has been to generate and implement evidence-based practice and clinical practice guidelines in critical care nursing to support the delivery of efficient, equitable, and safe care for the critical ill patient. As a scholar, I use evidence-based approaches for simulation in promoting patient safety in nursing education.
From the state of South Carolina, Lisa Davis.
With almost 3 decades in state government, I have successfully influenced public health policy at the local and state levels, managed annual program budgets of more than $317 million, and developed statewide and regional programs supporting current and future nurses while promoting health equity.
Lori Donnell.
I consider my contributions to nursing science in terms of the focus of my research and the processes that guide my work. I conduct equity-informed research on issues of digital health literacy and technology-enabled models of care. This is in service of some of the most disenfranchised people, both locally and globally.
Terry Fowler.
My significant contributions include creating interprofessional primary care models that address complex access challenges for medically underserved populations. These models demonstrate that nurse-led academic community partnerships reduce health inequities, improve access, and support workforce development and community-based primary care.
Karen Kane McDonald.
My primary areas of impact are community engagement and the development and testing of culturally sensitive interventions targeting diverse populations at high risk or with an actual diagnosis of early stage lung cancer.
Angela Mund.
Through my work in nursing education and advocacy, I've been able to educate, mentor, and inspire nurses to use their powerful voices and experiences to advance the profession of nursing. As a nursing leader, I've been gifted with opportunities to motivate others to take their seat at every table where healthcare decisions are made, whether in clinical practice, research, or education.
Mary Ellen Wright.
Through my roles in nursing, I have addressed multiple issues, including substance use in the perinatal period. My research on the effects of prenatal kratom exposure is cited by the World Health Organization and implemented kratom core tissue toxicology. I co-created international educational programs on substance use for medicine, nursing, and social work, and I continue to develop nursing as caring theory.
From the country of South Korea, Chin-Yang Cha.
My contribution in nursing has been researching determinants of women's health through conducting Korean Nurses Health Study, which is a national core study, and developing technology-based interventions such as AI-assisted burnout reduction programs for nurses.
From the country of Switzerland, Manuela Ehar.
During my 30 years in nursing, I have educated and mentored many advanced practice nurses, focusing on shared governance that has shaped future nurse leaders. As a nurse scientist and together with my team, we have focused on improving the outcomes of patients with cancer through enhanced symptom management.
Franziska Suniga.
My work connects research, practice, and policy to improve the quality of care of frail older persons in residential long-term care. I foster new care models that promote nurses in clinical roles and reduce hospitalizations, and I lead a national implementation program strengthening data-driven quality improvement.
From the country of Taiwan, Cheryl Chai-Hu Chen.
I study and implement targeted nursing care bundles for older patients, addressing their delirium, dysphagia, and functional decline. Those bundles are being integrated into sustainable hospital programs in Taiwan and beyond.
Hui Sun Chiang.
My contributions to military and disaster nursing have enhanced health outcomes through policy development, education, and research. I've improved disaster preparedness, managed mass casualty incidents, and advanced care for traumatic brain injury patients, while strengthening the education of military nursing students.
Yachu Haseo.
My contribution includes creating healthcare research centers and establishing international collaboration system at the largest nursing school in Taiwan, offering faculty and students opportunity to work with global nursing experts.
Shuyu Kuo.
My work has significantly advanced nursing education and clinical practice. I've developed innovative educational strategies to address clinical needs and enhance patient safety. Through international collaboration in perinatal health, we optimize maternal and child health outcomes.
From the state of Tennessee, Bobby Bellflower.
My contribution to health has been through my work as a neonatal nurse practitioner and educator. I've provided care for medically fragile newborns and their families through practice, research, and national leadership.
Beth Hallmark.
The most significant contribution I have made to health has been through the education of both faculty and students. My passion for high-quality simulation nursing education has had a substantial and sustained influence that has led to tangible improvements in patient safety, inclusivity, and interprofessional collaboration.
Keisha Powell Roach.
My innovative research on pain mechanisms has had positive impact on patient care and health outcomes in persons living with sickle cell disease. Among the first to characterize quantitative sensory testing reference values for healthy, pain-free African American adults, my work is included in training of healthcare professionals in 23 states and 8 countries.
Diani Stordorf.
My research in teaching and implementation science improve nursing practice, the quality of care, and patient safety. I work with multidisciplinary teams in hospital settings to develop best practices for the implementation of healthcare interventions that improve outcomes for patients with heart failure and medication safety in hospital settings.
Nakacha Bridges.
My significant contributions to health have been practice innovation and professional development, empowering nurses globally. For over 20 years, I have been at the forefront of cutting-edge critical care and oncology nursing, co-authored book chapters, developed hybrid webinars, and educated over 35,000 nurses worldwide.
Heather Cuvas.
My overall contribution is in research related to diabetes self-care, with a specific focus on maintaining and improving cognitive function. I'm one of the first to adapt a comprehensive cognitive rehabilitation intervention for people with diabetes, and my work is at the forefront of efforts to help Latino adults with diabetes and cognitive dysfunction.
Christy Nguyen.
Throughout my career as an executive and academic educator, I have been fortunate to contribute to the development of thousands of healthcare leaders, many of whom have helped drive change and improve health in the communities they serve. My most significant contribution to healthcare is improving patient safety, reducing turnover, and promoting nurse well-being at multiple healthcare organizations.
Angela Ross.
Through my work, I am creating a workforce proficient in current practices and agile enough to embrace and adapt to emerging technologies. My doctoral and grant contributions have developed programs offering flexible learning paths that accommodate different schedules and learning styles. The educational programs are up to date and readily accessible to aspiring nurses and healthcare professionals.
Cheryl Thaxton.
My contribution has helped the population of neonatal and pediatric patients receive better care and compassionate support at the end of life because I have implemented and disseminated long-term sustainable pediatric evidence-based curricula to strengthen national and international health delivery systems.
From the country of Turkey, Ayis Kardag.
Through my diverse work in education, research, and health policy direction, I have made a significant global impact by initiating and developing stoma and wound management services in Turkey and beyond.
From the country of the United Kingdom, Udok Arkebang.
I have made significant contribution to knowledge generation on inclusive workplaces, representative diversity, and diversity competent leadership in health and higher education. I am at the forefront of developing and evaluating diversity interventions to enhance health equity and inclusion.
Sir Jonathan Ashbridge.
My contribution is through leading national improvement programs in critical and emergency care and regulatory affairs. I have successfully influenced lawmakers to focus on patient experience. Over the last decade, I have built a person-centered cancer service for patients who receive chemotherapy in their own home. This has benefited thousands of patients.
Gina Higginbottom.
My contributions have largely focused on research in the field of ethnicity and health, addressing ethnic inequalities in health, particularly focusing on maternal and neonatal health. Most recently, researching the relevance of the APGAR score for neonates with dark skin.
John Unsworth.
I have impacted health by developing universal health coverage. Despite having comprehensive primary health care services, universal health coverage remains an issue for some of the most vulnerable in our society. To address equity of access and health inequalities, I led the development of community health nursing standards for homeless health and also for criminal justice nursing.
Emma Wadey.
The most significant contribution to healthcare that I have made has been prompting a paradigm shift, recognising the centrality of staff wellbeing to quality patient care, and leveraging my influence in professional appointments to spearhead evidence-based initiatives to prevent nurse suicide.
From the state of Utah, Nancy Allen.
My most significant contribution to health has been through my research and educational leadership in vulnerable populations within the context of diabetes and workforce development programs in equity, diversity, and inclusion.
Linda Hoffman.
The most significant contribution I have made to health is through my frontline work with nursing leadership students, chief nurses, nurse directors, managers, and clinicians, continually spending time with them, mentoring them to strengthen them to meet the challenging roles of healthcare leadership today.
Shelley Reed.
My contributions as a nurse educator encompass both simulation and the innovation of teaching methods for undergraduate nursing students in global health settings. The simulation debriefing evaluation instrument I developed has been translated to 6 languages and is used worldwide to enhance debriefing practices.
From the state of Virginia, Kathy Baker.
I believe in the power of the frontline nurse's voice, and I've elevated that through my national, regional, and local work in nurse staffing, top of license practice, and emergency nursing research.
Joni Brady.
My work has advanced the unique specialty of peri-anesthesia nursing. Together with other international nurse leaders, we'll bring education and training to low-income countries to improve patient safety, increase workforce capacity, and engage nurses in health policy advocacy.
Lisa Brown.
I have made a significant impact on health through the development of the mother-infant feeding tool, or MIF. This tool provides a structured method for the early detection and intervention of feeding issues in neonates. By helping mothers distinguish between adaptive and maladaptive feeding behaviors, the MIF enhances their feeding practices and strengthens the bonding between mothers and their infants.
Kathy Campbell. Helen Canton Peters.
Through my work in international public health policy, I impact the well-being of citizens across the globe. I guide governments in the development of equitable digital health strategies to transform and govern health systems. I build digital health literacy capacity for patients, the health workforce, and government leaders to implement efficient technical solutions aligned with universal access to care.
Gwendolyn Foster.
My contribution has improved the health care of our airmen, guardians, and their families.
Kelly Garber.
Through my work in practice, education, and advocacy, I have changed the landscape of healthcare and advanced health equity by expanding access to care through telehealth and empowering others to do the same nationwide.
Tina Guston.
My area of contribution in healthcare and nursing has been in telehealth. I've been responsible for policy, advocacy, and research, as well as training interprofessional providers and assuring that people that are less fortunate with social determinants of health and limited access have telehealth available to them.
Gerald Wallace.
My contribution towards the cultivation of nursing leaders across the armed services as licensed independent practitioners and nurse scientists establishes a foundation of health advocacy, diversity, and inclusion that transcends across the globe, that allows these service members to treat those who are in harm's way as they defend the United States.
From the state of Washington, Patsy Maloney.
Through leadership and innovation, I developed military medical teams for global deployment and created educational programs for nurses working in non-traditional settings in the U.S. and abroad. I transformed the specialty of nursing professional development through leadership, research, and publications, improving the nursing workforce essential to achieving health.
Jillian Pentai.
My most significant contribution to public health is the preparation of the next generation of nurse scientists through dedicated mentorship focused on research to advance HIV prevention, care, and treatment through nurse-led solutions.
From the state of Wyoming, Jill Price.
I pioneered developing and integrating healthcare systems in underdeveloped countries and innovative curricula in practice and education. I established a cardiovascular center of excellence in St. Croix, U.S. Virgin Islands, with a 217% improvement in survival rates and implementation of similar systems in other island nations.
The North Star question that guides my work is, how does a community provide compassionate end-of-life care to the vulnerable and the underserved?
Yeah. Thank you, Kathy. Everyone, what a remarkable celebration we've shared this evening. I would like to thank all of the fellows, families, friends, and guests who have joined us. To each of our new fellows, welcome to the American Academy of Nursing. Congratulations.
Congratulations.
बधाई हो.
Tahniya.
恭喜. Congratulazioni.
Kogordes.
Baie geluk.
축하해요.
Félicitations.
恭喜你.
Tebrikler.
Have fun celebrating tonight.